Hello, I'm Dr. Greg Winteregg, CEO of the Private Dentist Alliance. I want to talk to all of you students out there today who are wondering what your future is going to be like as a career in dentistry. As an assistant, as a hygienist, as a dentist, where is this profession going with the rapid increase of the DSO movement? I'm here to tell you that PDA is going to help you, and I want you to become a member today. It is free. Now, why should you become a member? You're going to get weekly video updates from me, and you're going to get regular updates of our newsletters from the Alliance on exactly what is happening and how we are going to help preserve and protect the private practice of dentistry. Now, to me, the most important advantage is you are going to get access to our job board. What is that? Our private practicing members all have access to our PDA job board, which means if they have an opening in their private practice of assistant, hygienist, doctor, front office staff, they're going to be able to post it. And you're going to be able to check up regularly. And as our membership grows, we're going to be covering larger and larger territories across the United States. If you are looking for a job in any position in the office of a private practice, you need to become a student member today. It is free. Go to www.privatedental.org and become a student member today. You're going to love your benefits. Do it now.
What is up, guys? It's your boy Matt Havis back at it again with the Dental Student Vibes podcast, and we have a hot and fresh episode out for you guys right now. This episode is starring Daniel Stallworth. He is a pre-dental student that just graduated from UCF, and he's also been a dental assistant for the past 14 years. So he's definitely put his time in, he's put his efforts in. He's looking to get into dental school, and he's picking our brains to see all the things that we know that we could try to bestow upon him to help him get an advantage to get into dental school. So we hope you guys like this episode. Tune in and make sure if you guys have any of your own questions that you shoot them our way on our Instagram at dental.student.vibes. We love to help. We love to answer these questions. All you guys got to do is shoot them our way, and then we'll get those answers out to you. So until next time, this is Matt Havis signing off.
Welcome back to another episode of the Dental Student Vibes podcast. I'm Seth Kalish here with Matt Havis, and today we have a very special guest, Mr. Daniel Stallworth, the man from UCF on his journey to dental school. Daniel, how we doing today?
I'm doing good, brother. How you guys doing?
Good, man. So
Go Knights, by the way.
Go Knights.
Fire John.
Wait, are you guys really the champions, the world champions? No?
We're the champ.
I graduated from there, and I don't even think that.
Oh, man.
Before we get started, do you think we could have beaten Alabama?
Say it again?
Do you think we could have beaten Alabama that year?
No.
That's my point.
I don't know what kind of pixie dust got on top of UCF, but I need some of that.
Yeah.
Oh, man. Okay.
So Daniel's joining us today. We're going to be talking about Pre-Dental Mentor. We're going to be answering Dan's questions. We're going to be talking about our services, everything like that. And I know Daniel is really, really motivated, one of the most motivated guys I've met. He was also my mentor when I was a dental assistant, and he taught me everything that I'm teaching. You know, I'm teaching students right now the impressions technique that you told me. You know
Really?
that, right? Dead serious.
How's your impressions coming out?
They're good, man. They're good. I swear. But also managing the patient is so much different than the mannequin, you know?
Oh.
So, but when we get to the patient, it's yeah.
Every patient is unique, and you got to accommodate them.
Right. For real. So, Dan, give us a little background about how you got to where you are now, and then we'll talk about your current situation in the application cycle.
Right now, I just finished UCF with my spring term. I graduated.
Congratulations, by the way.
Thank you.
Congrats.
Unfortunately, I gotta. You guys want to see it? I'll show it. It's terrible. I wish I would have walked. I got a congratulations letter. That's all I got.
That's still great, man. That's still great.
Hey, frame it.
Yeah, for real.
My brother got the same one. He graduated this semester as well.
Oh man, no man, it's been a long journey. A lot of working, a lot of schooling. Just gotta make sure you have great time management. It is doable, especially now as new majors come out. For all the students out there that are not aware, look into the new major called interdisciplinary studies. Very accommodating. Basically, a lot of it is online. The only thing is you do have to fulfill all your prerequisites for dental school. So obviously you do have to go to some of these classes that are on campus as far as all your sciences. So it's very accommodating. That's how I finished my my bachelor's. I went from what is it, pre health science, and I switched it over to interdisciplinary studies to finish my last credits because I already had all the prerequisites for dental school. So my only issue now is, like I was talking to Seth, my GPA right now is at a 2.8.
Mm-hmm.
I'm not at a 3.0, and what I'm trying to do is boost it up to a 3.0, which is what Seth recommended, but also trying to take the DATs and submit my applications as soon as possible. But my issue is if I submit my applications now, schools are going to see my current GPA of 2.8, and automatically when schools see that, they automatically more than likely nullify your application and toss it to the side. But unfortunately, my resume speaks for itself. I mean, I've been in the dental field, I think, going on 14 or 15 years. So the experience is there. Unfortunately, I was young, grades were not that high, and my GPA just was terrible. And to boost it up has just been a mission.
Right. And so, yeah, you bring up a good point. When it's under 3.0, that's usually like a cutoff. That's kind of a filter for a lot of schools. But the way that I've seen a lot of people get past that is, like you said, post-bac classes, and then also taking a master's degree, right? And so you said that you're thinking about doing something along those lines.
Right now, I'm trying to take several classes at UCF. Unfortunately, with this whole pandemic, the College of Graduate Studies at UCF has been backed up. So it hasn't allowed me to take classes for the summer term, which I've been on them for the last 2 weeks to resolve that issue. So if students are not aware, once you graduate UCF, it's not like you can continue taking classes. You do have to go through a process of signing up again, of taking non-seeking degree classes. So just make you guys aware, because a lot of students weren't aware of that. I wasn't aware of that. I thought I could just log into UCF and continue taking classes since I was a student already, you know?
Right, exactly.
Okay.
So one of the other questions that you mentioned when we talked previously was, you said once you finish the spring term, should you jump directly into the DAT, into studying for it? So that's what you're doing now, right?
Right now, yes, I'm studying. Right now, I'm doing a DAT boot camp. It's very good. It's to be honest, it dumbs it down completely. So if, like myself, I haven't taken chemistry or orgo in like 3 years. So it's a complete refresher. I don't remember a lot of it. I'm gonna be honest with you guys. But this service that Ari, I believe his name is,
Right.
provides is amazing. It breaks everything down. So somebody for like myself, I know Ari has a schedule, which I just started to follow because I didn't feel strong in my chemistry and orgo. So I went ahead and did a chemistry and orgo on my own. And when I finished it, I said, all right, let me go back and let me jump on his schedule, his 60-day schedule, and I'll go from there.
Exactly. And
Very
I mean,
nice.
it's definitely very important to maintain a schedule. You know,
It
you
does.
got to stay
It is.
organized with that, or else you'll
Yeah.
fall behind. So what's your whole DAT process that you're going through besides DAT bootcamp? Have you tried anything else?
Um, I had used the DAT. What is it? The DAT Destroyer, I believe
Mhm.
it's called. No, you recommended to do the DAT bootcamp, and once you recommended, I just jumped off of the DAT Destroyer and I just got onto DAT bootcamp. I read a lot of good reviews. A lot of people are writing that DAT bootcamp it's a lot harder than what the test really is.
Mhm.
So you become over prepared.
Mhm.
Right. That's good. That's a good thing.
I can speak on that for myself. I used boot camp to study, and when I took the exam, it was like layups compared to some of those questions.
Yeah.
Boot camp was boot camp was it was tough. Like I remember some of the hardest questions that you can answer. Like at least when I took it, this was years ago when I took it. I think I took like 3 or 4 years ago,
Mhm.
4 years ago actually. And when I took it, it was tough. Like the practice exam I had, one of the questions, like I said, like 6% of people answer correctly. So that question would be like thrown out in the exam. You know what
Mhm.
I'm saying? Like in a regular, DAT basic like boards exam. But so I would use that honestly. What would you say are your strong subjects for the DAT versus your weaker subjects?
Like I mentioned, Orgo and Chem are my hardest subjects. Quantitative, what is it? Reasoning.
Reasoning,
Mhm.
right?
Math is my strong suit. Reading is my strong suit. Um, so that's why, like I said, I started with Orgo and Chem. You know,
Nice. Very nice.
to go over it on my own to refresh myself. I didn't want to follow the schedule because I don't think it would have been any benefit to me. I wanted to do it at my pace, and then once I went over it once, then go through the schedule.
Nice.
Uh,
Okay. I get what you're saying now. What about
yeah,
the PAT? How do you feel about that?
I haven't taken the PAT. PAT I haven't taken.
Okay, you got to get
Okay.
on
Yeah,
that.
you gotta. That's important.
Yeah,
I mean, it's
because
not.
that's a practice. And it's
Yeah.
really that one, it's just about the tricks and the little techniques of how to do each one of the sections within
Yeah.
it. Because
Okay.
there are specific, like you can do it without knowing the techniques and you'll score one way. Once you figure out like this is like a method of how to like keyholes, there's a specific like way, like you draw certain things and there's a specific way that you do it and it will increase your score by
Yeah.
a ton.
Like
Okay.
for the angled tests and everything, like for that section, it's. I guess it's one of those things where you kind of just have to do it, like, and it's just repetition, and you kind of just start getting an eye for it. Like my
Okay.
eye developed to do it. Like you start seeing individual, like little idiosyncrasies about each angle, and you're like,
Okay.
okay, this one looks bigger than this. So I would just recommend for that. I just did a lot of practice. That was my highest section when I took the exam,
Okay.
and I practiced my butt off to get good at it. Because when I first did it, I scored like a 16 because I didn't even think like, oh yeah, you just take the section. And it's kind of like a whatever thing.
Yeah.
But there's tips and tricks you really gotta do. But
Yeah.
boot camp, for me, I can speak for myself. Boot camp prepared me very well
Right.
for the PAT.
And you have access to the PAT generator, right?
Yes. Yes.
Yeah,
So there you go.
Oh.
And they didn't even have that when we took it.
yeah.
So now they've got the generator, and that should really, give you a lot of practice. So let's talk about your scores. So when you did you start out with a first like practice test, just kind of see where you're at?
Let's talk about that. Let's talk about when I first took the chemistry, because you want to see where you're at and how where your level of knowledge is. Man, when I first took my chemistry test, horrendous. It was a 4. It was a 4.
Yeah.
Okay.
Now, after going through chemistry, I took it 3 times, and then the 4th time, I scored a 17.
Awesome. There you go. So you've taken it 4 total times now, correct?
So they have a total of 10 tests.
Right. And you've taken 4 of them.
Of the 4, the last one, each time I have increased my score. So the 4th one, I have gotten a 17.
Cool.
So I suggest, make sure you mark down questions. The great thing about DAT Bootcamp is that you can mark questions that you're not sure about, and you can always go back to it. That's a big help because a lot of times some of the things I know, some of the things I don't know, so I mark it to go back and review it. Make sure you take down notes. If you don't still understand it, make sure you got YouTube at your disposal. You have Google at your disposal. Use them. The tools are out there. The knowledge is free. It's just you got to look for it.
Right.
True.
So how long are you going to do these tests for? How long have you been studying now total?
Orgo and chem, I've been doing now for about 3 or 4 weeks.
Okay.
And literally I just got on Ari's schedule.
Right.
Okay.
So I'm trying to double up my days. I know he has, bits and pieces every day, but I'm trying to double it up.
Gotcha.
So,
okay. I mean, that's definitely the right direction. What is your final plan? Like, so one of the things that we recommend a lot is try and get all the tests done, and then also try and do like at least the first 3 or the first 4 tests on repeat. Like, I've done it several times. You think you can manage that?
I can. My final goal, my end goal is at least of the 10 tests, I want to score at least 7 of them over 23, 24. That is my goal. And time management.
Right.
Time management, learn how to eliminate answers that has nothing to do with the questions. Should help a lot. Right now, it's just me trying to process the question and complete it.
Right.
I can only tell you it's stressful, but once you get it down, I mean, it becomes a lot easier.
So how are you doing because you're talking about time management. I think time management really comes into play with QR. So how are you scoring with the QR?
My very first test, I believe I had a 12? Right now, I'm sitting at like a 19.
Right.
Very nice.
Okay, so all that matters at this point is that you're improving and you're going upwards. Now, it's time to break the barrier of the 20. Let's get past that, right?
Right.
So that's the next goal right here.
That is the next goal. How do I get to the 20s? Man, it's just you try to think of other ways and you just procrastinate. You just see problems and you freak out. You're just like, oh man, what do I do? Because you're on a time crunch, and the minute that the time is over with, that's it. You can't go back to it. My whole thing is, which it's helped me a lot. The reason I've been improving my score is the minute I see a question that I don't understand, and I don't know if the DATs you can go back questions.
Yeah, you can.
My whole thing that I've been doing now is if I don't know the question in the first 5 seconds, I'm on to the next. Because all you're going to do is lose time. So you might as well just answer the ones you know. And then if you have about 10 minutes, 15 minutes at the end of everything, just go back to the other questions you don't know, review them. Shoot, if you got 5 questions that you didn't know and you can at least answer 2 right, 2 is better than not answering 5,
Right. And that's almost exactly what the case was with the QR. Is you cannot believe how similar the QR in DAT bootcamp is to the real thing. I was like shocked. I was like, I've done this so many times.
It's just
and then I finally, I just took the test. And so you recognize, you're like, okay, this one's going to take me a little bit longer. I'm just going to skip it and do all the ones that take like, 30 seconds. And you skip those ones, you still end up scoring pretty high.
What might help too with getting the DAT test taking mentality, what I learned was I kind of went backwards. I did PAT first because of how bad I did the first time, and I just wasn't happy with like my score because it's such an awkward section. It's so different than anything you've ever done before. So I looked at it as a challenge of let me get good at that first.
Okay.
And that taught, I guess innately, I didn't even realize I was doing this. It taught me time management because they give you like ballparks of how long you have for some of these questions. It gets to like, I think the angle bisecting question, I mean, at least when I took it, it was like 9 seconds per question.
Oh, wow.
Because so there's like, you have 9 seconds to answer one question. So you had to get fast. So if you could answer one question in 9 seconds, you sort of kind of like apply that. you know, to a different section. So if you can try that, so you said you haven't really done much of it yet, try it out, see what you think, and maybe you'll pick up on it. And some people they just pick it up and then they're just naturally good at it. You know, like one section I struggled in, and then another section once I figured it out, I was like, okay, and I started getting all those right. You know what I'm saying? So, and then it's a confidence booster too. So capitalize on your strengths. Just know that, like, think about it like this. Sure, you're not going to be great at everything. At least, well, some people aren't. But if you are, you're blessed with it. But so let's say that you're really good at one thing, use that to your advantage. Tell yourself, okay, well, I'm going to crush that section, and then that'll make you feel good in a section where you struggle a little. You know what I'm saying? And it kind of gives you a boost. Try doing that. That's what I did, at least, because there are some things where I just struggled with, and then other things I was like pretty good at, like the block counting section. I was good at that, so I used that kind of like to get me through like the keyhole thing, because I struggled with that.
Okay.
So
how did you guys manage biology? Any recommendations? For me, I feel biology is just straight facts and memorizing.
Yep. So here's the thing for the biology, go through 100%. If you go on the ADA or ASDA or whatever website it is with the old exams, go through that. And then when you can't do exams without reviewing it, right? So if you go back and you're reviewing it, any question you get wrong, write it down on a flashcard. Absolutely make sure you do that. That's crucial. When I was done, I had legit like a 12, maybe 13-inch stack of flashcards, swear to God. And I would go through it because I told you I studied for 3 weeks for like 10, 12 hours a day, every single day. And I would start out for like an hour and a half, just running through the flashcards, because there are some of the exact same questions or the exact same topics on the actual test. So that's number one, right?
Yeah.
Go through the old exams. Number two, go through, they still have the what is it called? The Cliffs notes or
yeah.
Right. So go through that one. Don't memorize every single detail. Maybe just like because when you go through biology, see the section that in biology that you're scoring low in, then go through that. But I promise you, the highest yield technique you can approach this test with is taking the practice tests over and over and over. Start out like you should be taking a practice test every single day.
Okay.
You should be doing one test every single day, and then you can go back and review it. That might take like 5 hours, 6 hours, but you need to do that. That's so crucial. And then you can go back and do individual sections. And the more times that you do that, I promise you that will help you, because it's not just the material, it's also your test taking skills.
You almost get robotic with it. Like, I did so many practice exams that by the time that I stepped into the exam, my body went into autopilot. I almost blacked out during the exam, and I came out, I was like, oh my God, my score pops up, here I am. You know what I'm saying? I don't remember myself taking the exam. I really don't. Yeah, you just draw. I drew a blank, and then I just came to it, and I finished the exam. You know what I'm saying? So, I mean, that's just what happened with me, because I did so many exams. It's kind of just repetition. It's just another day.
Right.
You know.
Right.
So,
Dan, one of the other questions, I'm looking through your questions right now. One of the other questions you had for us was, what should you do about the application timing and also taking the DAT? Should you wait to take the DAT till you really study for it, or should you just submit? So one of the things that I was recommended to by an advisor back in the day was get your DAT done. You might have a 18, 19, whatever, submit it, and then submit your application, your dental school application. And then after that, send an email to all the schools that you apply to and say, hey, I submitted my application. However, I'll make sure that you know that I'm taking the DAT in whenever, right? In August, in September. And then, so they'll have your application on file. Then the second you take your DAT the second time, go and back and email them again and say, hey, here's my updated scores. Do they still do the printout? I think they do the printout when you walk out of there. So take a picture of that and put it in an email and send it to them, because you're going to be scoring higher.
So you want me to, so you suggest taking the test once, submitting those scores, okay? Inform them that I'm taking the test again.
Right.
And then that I will be submitting the scores at a later time, the second scores.
Yes. And then make sure that the second that you walk out of the test, take a picture of that paper and send it. However, let me throw a disclaimer in there. Obviously, make sure the first time you take it, you're not still bombing on the practice test. You know what I mean?
Yeah.
Like you got to be at a decent point. Like you should be getting 20s on.
That brings me back to my issue. When I submit, my GPA is not where it's supposed to be at. I mean, that's my only downfall. Like,
Right. And that's a thing a lot of students are facing. So your post-bac classes, and then have you considered applying for a master's degree?
no, I haven't. No.
Because they have one over here in Tampa at USF. That's one I did. Really good.
It kind of just like funnels you in too.
Yeah, because a lot of schools
Mhm.
have sort of these pipeline programs, and they kind of, it's like a feeder program, you know, and a lot of students who take the master's go directly into med school.
And they're
Okay.
very successful too. Like all of our master's school students in our class excel on the books.
Right.
Like they do very well in the coursework.
Right.
Because they've seen it.
These courses are all on campus.
Oh, they have, at least I know for USF, there's a girl who's one of our clients for Pre-Dental Mentor, and she's taking online master's degree.
Okay.
She actually has to go in one day a week, like on
One
Fridays
day.
or something, for like an hour. So,
Okay. I might have to look into that.
yeah.
Definitely need to boost my GPA. I wish everything started backwards. Like, hey, look at my resume. Don't look at my GPA, because my 14 years of experience speaks a whole lot, you know?
Yeah. But you know what? I'll tell you one thing. When I got on the phone with some of the schools, I informed them that, because I had already applied, and then I told them, like, hey, I was a dental assistant for the past 6 months. And they're like, oh, really? That's a big deal. And then that was like on a Friday, and then I got a call on the Monday. And they were like, congratulations. You know, I swear to God. It was literally like that fast, just because of that conversation.
Oh, nice.
So, yeah. So
But this was a phone call. This wasn't even an interview.
no, I had already had the interview. I already had all that stuff.
Okay.
But like, I think in your case, because they love like hygienists and dental assistants and everything, and because you have so much experience, I think that kind of sets you apart. You're like a little bit more of a unique prospect.
Like clinically speaking, like you'd be top of the class. Like we have one or two dental hygienists in our class. I think one.
Yeah.
And her work is impeccable. Like
Yeah.
I've seen her work, and she does like great stuff. Like she just picks up on it, I guess, because she's been in the mouth and she's seen it all or whatever.
Yeah.
You know what I mean? So same thing for you. Like you'd have,
And you know how to talk
huge
to
edge.
patients. You know, that's a huge deal.
It's-
So
it-
They factor all that in.
It's different when you're working on a patient versus working on Dexter. You know?
When there's the tongue in the way and
Yeah.
the foggy mirror and
also
Yeah.
Dexter doesn't talk back. So
Yeah, Dexter doesn't talk back. And then you just, you know, you got to learn how to manage your patients, and everybody has their own thing, and it's fun.
Sure. All right, Daniel. So what other questions do you have for us? I know you asked a lot of questions beforehand. What else are you thinking about all this stuff?
Letters of recommendation.
Right.
What do
Okay.
you suggest?
All right. You definitely have access for getting your letters of recommendation from any of the dentists that you work with.
Okay.
Easy, right? So
Certain amount?
I would. I'm sorry.
Any certain amount?
Every school has a different number, so that's
Okay.
it's gonna be according to that. I think I had a total of 5
Same.
letters, either 4 or 5. It's usually only one dentist, but they want more academic. So your classes from this past semester, just email the professor. Just do it. Just be like, hey, I got an A in your class or whatever, and I am applying to dental school, and we actually have a template that we can send you, and it's perfect. And I actually did that. I drove up to Tallahassee to my undergrad at FSU, and I walked into his office. I was like, hey, I just drove here from Tampa, and I got an A in your class. Would you mind writing me a letter of recommendation? I'm applying to dental school right now. And you know what he did? He did it. And that was like, I had taken his class like 3 years prior. He didn't remember me whatsoever.
I mean, that's good and everything. So when I applied, I had 5 letters, 2 science professors, 1 non-science professor, and then 2
Okay.
dentists. So I looked for quality and in my letters. So for instance, I'll give you my dental ones. So I went to my dentist that I grew up, like he's my pediatric dentist, but you're a patient for life, so he still sees us or whatever.
Yeah,
So I
yeah.
went to him. I've been shadowing him. Like when I got into dental school, we took a picture, like all this stuff. He was so proud of me. He wrote a letter and he let me read it. It was one of the most heartfelt things I've ever read. Like I almost started crying that he would say kind things like that about me. Like it helps when they care. But let's go to like professors now. So I had one science professor that I was cool with, and she wrote me the letter, and she wrote it with me, and she's like, I'm gonna write it. If you don't like something, I'm just gonna take it out. And I mean that happens, and the letter was phenomenal. The second letter, I got an A in the woman's course, and I was just like, hey, you mind writing me the letter or whatever? And she's like, yeah, cool. And she just wrote me like a cookie cutter generic one. She probably got off Google or something.
Right.
So, but I didn't have anyone else. You know what I'm saying?
Right.
But my other letters, so like my business professor, I took one finance class, and I had him write me the letter. And I went to his office 3 hours a day. Every day we talked business, we talked everything finance, planning, and everything. Like I'm somewhat financially literate right now because of this man. And he was a brilliant, brilliant guy. So, and he really took the time, and he saw I gave a crap. So we ended up like clicking really well. And he wrote my letter and he sent it to me, and he wrote a very, very nice letter. So if you can find, and you don't have to use the same like format where you have like 2 science, and then 1 non-science and 2 dental, but try to have quality letters.
Okay.
That's what I'm getting.
So these letters, they go attached to your application when you submit.
Right.
That is my assumption.
Right. And
So
a
you
lot
have
of
your
them,
application, you have your letters, you have your score. All of that goes as a package to the school.
yes, everything is through AdSas. And so you
Okay.
sign up through AdSas,
Mhm.
make an account, do all of that sort of stuff. And it will walk you through, and we'll walk you through as well.
Yeah, you're at an advantage because we both went to UCF. UCF has it's called a letters packet service, and
Okay.
you submit the letters to the pre-professional society, and they automatically send the letters for you.
Okay. That's
So
awesome.
you can do that. So
Right.
all you got to do is just get the letters to the pre-professional society.
Okay. And they send it out.
Yep.
Yes.
So they send out the whole package for you, your scores and everything.
Yes, it's all electronic.
It's called a letters packet. I'm sure you could Google it or like search it up on
Right.
UCF's site, and they consolidate it all into one place, and then they send that file over.
Right.
So you're not missing anything.
Okay, let me mention 2 more things about this. So first of all, most professors will not want to write you a letter. They'll be like, "Can you write the letter for me?" Swear to God. And also, they will also show you the letter. Hey, is this okay? They will show you what they wrote. So first of all, be able to write a letter for yourself, and make sure that like you brag in it and all that sort of stuff. And make sure that like you say, hey, you do it kind of cautiously, kind of read how they're responding, but say, hey, if you would like, I can also give you a pre-written letter, or I can provide you with more information. When you ask for the letter, one of the things that we recommend is provide your resume with it as well.
Okay.
Okay.
Big time.
And that's another thing that we offer with Pre-Dental Mentor is help with the resume, make it a beautiful resume.
Yeah.
And I know you've got a very extensive one, so.
I'm gonna bring you like a whole receipt.
Right, exactly. Like a CVS receipt.
Yeah.
Okay. Are you guys planning on doing any specialty or?
So we right now have kind of gotten the vibe that there's a movement towards general dentistry, like super GPs, general dentists that do everything, right? Because think about Smile Direct Club. It's kind of throwing shade at orthodontists. You know what I'm saying?
Yeah.
So even though orthodontists still have to do those crazy difficult cases.
You got GPs taking CE courses to do like easy class 1 cases, orthodontics, but then, so it's kind of like pushing the orthodontist aside.
Right. But here's the thing. So because of COVID-19, that is a total game changer. Total game changer. Things are shifting like crazy. And now we do a lot of reading about the current state of the industry. And it seems like there definitely is a market for specialists, because think about endo. Like endo is all, you could consider most of it emergency, right?
Yeah.
Most of the time. So like, do you think they're getting affected too much by it? Maybe not as much as a cosmetic dentist. You know what I mean? So what do you want to do, Dan?
Most definitely, I want to try to specialize. I mean, all I know is ortho. Is not that I don't know general. I know general, uh, which brings me to a point. If I can do ortho and do certain CE classes to do class 1 cases, orthodontics, I'm fine with that. If that means, if that saves me 2 to 3 years, because a lot of these programs for specialty for ortho, they're going to board certified, meaning 3-year programs. They want to see cases finished. So they're wiping out a lot of these 2-year programs.
Right.
So
It's changing, man. It really is.
So if I can be a general dentist and do some sort of ortho, whether it's Invisalign cases, class 1 cases, I'm fine with that. That's
right.
Yeah.
It'll exactly. It'll be a lot of class 1 cases. And I think that, you're smart by already thinking ahead. You're not even in dental school yet, but you're already thinking ahead about residency, and that is a crucial thing to kind of visualize, have a vision about where you want to be.
True.
You know?
What else can I ask? How does this whole interview process happen? Once I submit, how long does it usually take for me to hear back from the school if you guys are considering a student?
Okay. Awesome question. Submit, get the secondaries. Hopefully. Most schools will give you a secondary because you got to pay some money for it. So do they make money off of it? I don't know.
Say secondary, what do you mean?
It's literally a secondary application. If they like your application, it's a secondary, and it's just more essays. So that's one of the other things we're going to help you with, is we're going to help you with these secondary essays. And now, okay, so you write a personal statement, right?
Right. Which I got mine. I have mine already saved. I have mine on.
Cool. Perfect. And if you need help with that, we'll help you with that, of course. But now the secondaries are going to be questions specific to the school. So I know there's one in Arizona that said that was asking about the Indian reservations. Is that something that you would be interested in? Like that sort of thing, So because that's one of their outreach programs, and that's one of a big focus of a lot of dental schools is outreach programs serving the underserved community. That's in the secondaries. So we're going to help you tune your essay. They're I don't know, what is it, like 500 words or 750?
About something like that.
Something like that, but they'll have like 3 questions. And the key to this whole process is timing. So you got to get that submitted, boom, like get that done within the week, send it off. Because some people will wait like months to do it.
Yeah.
And the other thing is I've got a nice chart that I'm going to send you, and it's going to be for all your secondaries, how to keep track of them, because dude, you will lose track immediately. God. And you will lose track of like when they're due, all this sort of stuff.
Okay. The worst thing to do is like in your application process is like count yourself out because you messed up. You didn't get something submitted on time. You didn't pay for something on time. That's just a waste, honestly, in the application cycle. I'm the type of person where, like, when I was applying, the day it came out is the day I did it.
Okay.
And it helped because then I could sleep well at night.
I learned a saying. I don't know. No, you never met him. By a orthodontist. He goes, "There's no time to waste time."
There you go.
I like it.
There you go. That's it. So, all right. So let's get back to your question. So that's the step before the interviews. Now, most schools start around September with the interviews. You'll have your first.
Okay, that's a good point. I'm sorry to interrupt you. What are you doing now with this whole pandemic thing with interviews and everything? Is this getting pushed back? What are you guys doing?
That's a great question. So a lot of schools are going to have their own individual way of doing the interviews, and it could be on Zoom. Obviously, a lot of schools like to do this kind of, they do different sorts of things. Some have group interviews, some have one-on-one, some have two-on-ones, some do some sort of hand skills activity, all that sort of stuff. So, and it's kind of unfortunate because with the interview, you get to take a tour of the school. And you don't think it's that big of a deal because you're just like, just let me get accepted somewhere, But I'll be honest, like it does make a difference. One of the other things that you can think about during this whole process with the interviews is like if you're waiting for the interview, you can put in some other letters, and it could be like a letter of intent, that sort of thing, kind of to just like ping the admissions and say, hey, I'm still here, I'm still waiting.
Yeah.
So that's something else we're gonna help you
But
with. I got a letter written, and I'm gonna send that to you as well.
It shows you're serious too.
Yeah, like your interest level is pretty high.
Yeah, exactly.
Here.
And they like that. They like to see the interest.
Right.
Yeah. How long is usually interviews for? Once you go in,
It's
It
an all-day
goes
thing.
until. Are you saying like the actual when you walk in the school, or like how long are they offering?
once you're in front of the person that's interviewing you, how long is usually that interview? And how intense does it get?
So some of them are like, if you're fortunate to have a good interview, you'll just be chit chatting like you and I are now.
Yeah.
We've had those interviews. I had an interview like that in a school up north. Literally, the lady's just sitting at the desk, sitting on the top of her desk. I'm just sitting in the chair. We're just talking. She's like, Seth, you know what? I really like you. I hope you get in here. And like, she said that. Like it can be that informal.
Mm-hmm.
Or there was another school where there was, I think it was called MMI, multiple mini interviews, and there would be a timer, and you have to walk into every single like these different rooms, shut the door, and you have
dental interviews.
Yeah, you have 90 seconds to answer a question, and then you have to walk out.
Oh wow.
And so that one was intense. But like the one, I don't know, like I just didn't get a good feeling from that. But like
It's like
some
speed dating.
Yeah, some schools do that, and other ones,
I don't like you. Pass.
yeah, right. But so like we're gonna help you with that. We're gonna do mock interviews.
Yeah.
We have a list of interview questions. We're gonna record an interview just like we're recording right now. We'll make it super professional. And like it'll be according to the different schools that you get interviews.
Yeah, and we'll watch body language, everything, just so because you speak 66% of what you say is with your body. So we watch body language, make sure that what you're projecting yourself well, because they're going to pick up on that as well.
Right.
Okay.
So.
And just another thing to throw in there, if you do the interviews on Zoom, well, boom, there you go. There's a great example of you practicing on Zoom for your interview.
Right. What other questions do I have? This whole pandemic just threw a wrench in everything. So a lot of those is just branching off of other questions as far as the whole pandemic that's happening right now in interviews and dates. Has any dates changed for you guys as far as starting next year's courses or anything that you can think of, or everything's still on time?
Not for us
We hit the ground
necessarily,
running.
but there are other schools that are cut short for some things.
Definitely.
So it's very unfortunate that that happened.
Certain schools are starting their D1s in January now.
In January, not even
Is that true? Wow, that's crazy.
Yeah. Yeah, my roommate's fiance told me that.
Okay.
Yeah, so I know, make sure that you check. They changed dates for like DAT. Like I think they extended a lot of things.
They extended it. I know they just started allowing, if not mistaken, people to take the DATs just recently.
Okay.
So I'm still within the loop. I hope I can take it before the end of August, the test. That is my goal.
Mm-hmm.
What else? Are you guys able to work? How do you guys manage that? I know I've heard it, God knows how many years now. Oh, I can't work, this and this. How do you guys survive? How do you guys manage?
Manage what exactly? Like just being in school?
School is time management, a lot of time management.
Yeah.
But more of your like financial stuff. How do you guys manage that?
We get a lot of student loans. That's a big key. Budgeting, obviously.
Yeah, you could try. I mean, it's tough to work. We have I know of one girl in our class. She works at Publix.
Mm-hmm.
I don't know how she does it, but she works at Publix.
Now, why is it so hard? What is the issue that you guys can't work? I mean, does the school not allow it, or is just packing so much information with school that it doesn't allow you?
Right, because we have to go to class for like most of the day.
Like
you have to
8 to
be
4 or
like
something
present.
like
And then other schools, you know, they do it on Zoom or whatever. Right now we're on Zoom as well, but you have a lot of stuff to do because not only are you studying for academics, but you also have to go in, you legit have to drill. Like you got to sit there for
practice.
like 5-6 hours and drill plastic teeth.
So you got to like.
I've been in that classroom. There's like a whole row, like sections of all the students drilling this. I've been in that room. That's pretty cool.
Yeah.
But it's like, it's one of those things where you go to school all day and then your day starts when you're done with class, because then you got to study the material you just learned for the day. You got to study prior material. You might have an exam soon. You got to practice if you have a practical coming up. You know what I'm saying? So it's like, you're busy. You know, usually like your break is made, if you like to work out, you go work out, study, whatever you do. You know what I'm saying? So
Now,
how much time?
Your first 2 years are more so your science courses and things like that.
Right.
Now, is this a quick, I'm going to move the laptop a little bit. Is that like a quick review, or is it more like extensive stuff that they're going over?
Yeah, it's extensive.
It gets in depth.
It gets deep, and like you get into, especially you start with like the sciences, like usually the first thing is like anatomy for a lot of schools, but then you'll get deep into perio. Right now we're taking temporomandibular disorder. That's one of like the most difficult subjects. We're taking the second level class. We're going to get into we've already taken like perio, oral surgery. We're done with all that stuff. Now we're in like hospital dentistry, geriatrics, all those sorts of things. We're in the final, like the end, but most of the end of the curriculum is like hardcore clinical.
Yeah.
So you're drilling on patients.
Yeah. But your first year is usually basic sciences, sort of. Yeah.
But is that like really in depth, or
what do you mean by in depth? Like how detailed oriented they are with that?
Yeah, or is it's just like a broad overview of, let's say, chemistry or orgo or whatever, or biology for that matter?
So they don't really just go like give you a chemistry course per se. It's kind of like they give you like pathology, or they'll give you like some biochemistry.
Right.
But it's not like, okay, this is an alpha helix. Like they pertain the biochemistry more towards like a healthcare sort of mentality.
It's all applicable.
Yeah, it's all, everything is applicable to like the body and everything. Like you're a healthcare pre-professional. You know what I'm saying? Right. So like your professional students, you have to learn healthcare about the body and stuff like that. So that's how they apply it.
Right. So like an example would be like, what is a lack of vitamin C cause, and which protein does that affect? And that would be a biochemistry question because what is it? Collagen.
Right.
You remember what kind of helix collagen is?
Isn't it like isn't like an alpha? Isn't it a super helix?
A super helix.
It's like the alpha helix.
Alpha helix.
It's an alpha helix, but it's like a triple alpha helix, right?
And so
and it like curls
vitamin
together.
C, scurvy, and then it makes your gums bleed. That's what scurvy, and then your teeth fall out because of the tissue. The collagen is not interlinked properly. So that's a biochem question.
But I mean, so that's how they run it. It's much more applicable, and you'll enjoy it more because you're like, oh, I hate whatever subject, but it's about the body, so you kind of enjoy it more. Like histology, they're not just going to give you like, oh, this is a prokaryote. Like they say, this is the type of cell you'd find in this part of the body.
So all the stuff that you've done in undergrad, now it's kind of a repeat of that a little bit if you've taken the same classes, but now it's applicable to dentistry.
Yeah.
Like you need to know this for this reason because it causes these disease states.
Exactly. Like that's just how the basic sciences work. And then they give you like a mix. So you'll have like your basic sciences, and they'll give you like a dentistry course, like I don't know, like dental anatomy. So you could be taking, like for us, we took like gross anatomy and dental anatomy at the same time.
Okay.
So you're learning about like the muscles in, I don't know, the chest, and then you're learning about the muscles in the mouth and like the teeth, whatever. So.
Right. Now back to once you apply, you get it if you do get accepted. Talk to me about the transition as to, all right, I get a letter today, I'm accepted.
First thing, have a party.
Yeah.
There you go. Celebrate, baby. Let's go.
I partied harder when I got my dental school acceptance than I did when I graduated from UCF.
Okay. Yeah. Man, I just want to get in, man. I just want to get my foot in the door, finish.
Yeah.
You will. You will.
I mean, I sit there sometimes at the dental office, and I'm just like, man, I wasted so much time. I've been here like 14 years. Half the time, the dentists, they come right out of school, and they're asking you questions. So you're like, come on, dude, you just finished. I shouldn't be helping you. You should, like,
I
come
got
on. Um,
Oh, man. But listen, that's gonna, you know how valuable that is once you're in dental school. Like,
I'm telling you, Dan.
you're gonna be on top of things.
you can't come in with some sort of ego. You got to keep it humble.
Right? No.
You can't come in like, oh, I know it all. I've been in the field for long. You got to come in with an open mind and make sure you absorb all the knowledge that your professors are giving you. You don't want to come in there, Mr. Know-it-all, because that's a huge turnoff. You know?
Yeah. No, that's the awesome way to look at things.
The best thing that you can do is help others.
Yeah.
That's the number one thing you can do with all this knowledge that you have.
But I look at it like this: you're at a good advantage because you don't have to, like, patient positioning, all this stuff. You've been inside the mouth. It's all normal. It's a way of life to you. You know what I'm saying? So by you doing that, you're not learning all the little bits and pieces that they're learning. Now you can like dive deeper into what they're saying.
Right.
You know what I mean? And you can pick up on the extra things that nobody else is really learning because they're still trying to learn the basics.
Right.
You know what I mean? They're trying to get used to having saliva on their gloves. And you're over here, you have it 24/7. So now you're focusing on the little bits and pieces and the tidbits that are going to make you above and beyond. It's going to elevate you. You know what I'm saying? Like that's what I mean by, you're at an advantage.
How? I don't think I touched on I was leading to the question and I got off topic. So once you get accepted, how soon do you guys make the transition as to like housing and things like that? What do you guys suggest?
So we actually, like most schools, make a Facebook group. So number one,
do you make it for your class? Like,
yes.
Yeah.
Yes.
Okay.
Actually, like we make them for the next class, and then people get like invited or they like find it. Right. Exactly. And so reach out to other people, say, hey, do you want to be my roommate, et cetera, et cetera. There's a whole list of resources. Every school's got it, like local apartments, houses, whatever, places to live. That, trust me, that is the easy stuff,
Do you guys, I mean, I'm assuming you guys are roommates, right?
He lives down the street. Wow. Two of the other guys on the podcast are actually my roommates.
I basically live here, though. I'm here all the time.
Sure.
You might as well bring your pillow.
Just get some bunk beds.
Yeah.
What is it, stepbrothers?
Yeah.
So much room for activities.
We got a hockey stick holding my bed up.
Don't touch my drum set.
Yeah. It's like a drum set. There you go. Great movie.
So is there opportunity, because I know I hate to sound like I'm old, but is there opportunities where you can just live on your own? Is that even possible?
Absolutely. Yeah. This is not undergrad. You do whatever you want.
Yeah.
You are a postgraduate student. You're a doctorate student. So you do whatever you want. They do have like on-campus housing. Of course, it depends on which school that you go to.
Okay.
But
one of the guys on our podcast, he lives alone.
Yeah.
He just doesn't. He likes it. He's clean.
I'm just thinking, I'm like, man, I don't want to be living with a roommate where he just wants to party every week while I'm just trying to get some studying in.
Yeah. But listen, the other thing is there's like married with children in every class. Every single class.
We have the full spectrum. We got 21-year-olds, and then we've got like 40-year-olds.
In a class, two classes before us, he was like 50 something.
Yeah.
Oh wow.
Kids, like his kids are like our age.
He was a lab tech for 20 years. He's a lab tech.
Like he could have been in dental school with his kids.
Oh wow.
They could have been like classmates together because he was just so old. But you get all different walks of life. We have a CPA in our class. Like
we have two CPAs.
Two CPAs.
Oh wow.
So,
yeah.
How do you guys work through with students that you got to pick up their slack? Do you find that happening, or everybody's usually on their game?
I'll tell you what, like once you're at this level, everybody is like trying to hustle. Not too many people are trying to slack off. And if there's somebody that's falling behind, it's not by their choice. It's because they need help. And you know what you do, Dan, as an experienced student and as an experienced dental assistant, you help them out. That's what you do. You help out everybody that you possibly can.
Okay, that's great to hear. That's good. What else? I know I'm gonna come up with other questions.
It's all good.
Go for it.
So let's talk about you and your brothers. So what's up with your brothers?
My youngest brother is actually catching up to me. He's almost done with his bachelor's as well.
Uh-huh. Nice.
Then the one that follows me is behind my youngest brother. But
Mhm.
we are possibly all going to take the DATs all at the same time.
Really?
Yeah,
Okay.
we're all going to take it all at the same time. It's three of us. What do you suggest as far as do you suggest somebody applying even though they're not close to finishing their bachelor's, or
There's definitely students that, well, so how far, like, it's for sure going to be how many semesters left? Do you know? Because there are
probably
students that apply to dental school as juniors in
okay?
college.
He
Yeah.
has about, I want to say, about a year and a half left. Versus
Okay.
my other brother, he might have, I want to say, maybe 2 terms left.
So it would have to be, they would have to have a record of their degree before they matriculate into
Okay.
dental school. So they have to graduate for sure before they matriculate. So whatever cycle lines up with that, and usually matriculation's like summer, right? Summer, fall. You just kind of have to figure that out.
Yeah, it's on a school by school basis. So
Right.
they also have, you have to make sure they have their prereqs done as
Yep.
well.
Yeah. The youngest one is just about done with all his prereqs. I think what's left is Orgo 2 and Physics 2,
Mm-hmm.
but he will be done with that.
Yeah, those
So
are the tough ones. Hopefully he does well with that.
I don't know how he does it. He works full time and he crams 5 classes in, and the kid is killing it.
Oh,
Wow,
man.
that's
Good
awesome.
for him.
So he works in a dental office. All my brothers work in a dental office.
Awesome.
Like taking over the dental
You
field.
guys are gonna start a group practice, and yeah, you're gonna run that.
That's the
Just
plan.
avoid Central Florida. They're going to monopolize Orlando.
That's
Yeah.
the plan, man. That's the plan. Just got to start little by little. Have you guys done it? You guys haven't done any outreach programs yet, right?
There's all sorts of stuff. So all schools have like basic like days, like there's like Give Kids a Smile, just like free dentistry days, and you can volunteer and do stuff like that, right? The outreach programs though, every school is different. Everything's different between every school. I just said that. But some will do like different clinical rotation sites, and you'll go all around the country. Some of them you're there for like a year,
Now, do schools help you once you graduate? I know you have different companies like Greenberg. They'll come and they'll check out the graduating dentists and they'll talk about their company. That I do know. But do they support you or help you in any bit or way if you want to set up like some type of outreach program? Because that's what I'm big into. I want to do something like that.
That's a good question. I think
it would vary on the school.
Yeah, it depends on the school. I think so tell me more about the outreach program that you want to make.
I want to do stuff for people that can't afford dentistry, you know.
Yeah.
Not only here, but go to other countries. There's a lot of poverty. There's a lot of kids that can't see a dentist,
Right. Right. A
So
lot of schools will have there's lots of programs out there, and you don't have to be part of any school. You can be a dental student, you can be a dentist, and you go with the program to whatever countries.
but I want to set up my own. I want to do
Right.
You
Right.
know.
That's going to be, I think, more of a business venture for yourself. It really just depends what kind of deals you make with people. But I'll tell you one thing. When you get through dental school, you get through all the year. We're D3s now, right? We're just starting our third year. But the amount of connections that we have made, the amount of networking we've done is absolute. We cannot follow up with as many leads as we have. I promise you. Like, we have so many connections. We've reached out to so many people in all areas of dentistry. So I guarantee you, if you're a hustler, like I know you are, you're 100% going to be able to do it. Yeah.
Now I know, Seth, you were collecting teeth at the office. I've seen a couple people do that prior to you, and I never bothered to ask. What is that for you to take to school? So when you need a model to start drilling on, you have teeth.
Yep.
On?
That's all.
So we've got these plastic typodonts, right?
Yeah.
And that's what we do most of the drilling. But you'll also see, the little sterile cups that you with the mouth rinse, right?
Yeah.
So you take mounting stone, put it into there, then you place the teeth, and you have them 3 teeth, and you have them contacting, and then you drill on the tabletop. And I actually did that with Dr. Barrett before I left for school, and we were doing endo, me, him, and Cameron, and we were doing endo, and like, oh my God, that was the most exciting thing ever, you know? So, but it's good because you get to see what the teeth are actually like, because the plastic obviously is not the same tactile sensation as.
It doesn't cut the same.
Do you guys recommend for me to start collecting teeth now or not?
I mean, you've got such a great access to all that sort of stuff.
Yeah.
I wouldn't worry about it too much.
You can honestly just, when somebody pulls a tooth, just put it in your pocket, just save it for later.
Yeah. Also, I have a Listerine bottle. Yeah, I have a Listerine bottle, and it's full to the top, and I've never used like half of them.
Yeah, so like they told us to collect a lot of teeth, and then we didn't use nearly a fraction of what they wanted us to.
Donated to the next student that didn't grab teeth.
Yeah, exactly. That's what we did. 100%.
I came in with 0 teeth.
Did you really?
Yeah, I didn't have any teeth. There was one time where they were like,
I had my baby tooth from like 20 years ago.
I remember they were like, oh, here, we need 10 teeth brought in tomorrow. I don't have any. So it's got this jar, like he's got a jug, like
multiple,
something from like a horror movie. It was
all from Dr.
bizarre.
Lawson.
Like, yeah, so we're in his kitchen with like forceps picking out good teeth, and he's got some for everyone. So yeah, definitely. I mean, get some teeth.
And you are bartering. Like, how much for 4 teeth? You need like.
People do that.
Oh, you could.
Yeah.
People look to like trade. Like, oh, I need a canine. Oh, you got a good premolar? Let's do the old flippity flop.
For real.
That's what they do.
Oh, nice. That's funny.
What is up, guys? It's your boy Matt Havis, and we're back at it. Hope you guys enjoyed this interview with Daniel Stallworth, pre-dental student from UCF. He just graduated. He's been in the field 14 years, but it's not stopping him from becoming a dentist. This is what he wants to do. He's setting his sights on it, and he will achieve it. So if you guys have any other questions pertaining to this topic, whatever it may be, follow us on Instagram at dental.student.vibes and shoot those questions our way. We'd love to answer them. We'd love to get these answers out to you and anyone else who may have the same question. So until next time, vibe on.
Attention pre-dental students. Over 12,000 applicants each year apply to dental school. Out of 67 accredited schools in the United States, an average of only 90 students per class earn the privilege of acceptance. As former applicants who struggled through the rigorous ADSAS process ourselves, we understand the hard work it takes to be one of the lucky few to get accepted. That being said, we are happy to announce that we are now offering Pre-Dental Mentor, a program designed to give back to the dental community and give you the best chance in getting accepted to the dental school of your dreams. Our brand new Pre-Dental Mentor program includes a team of 5 coaches who have all been a part of the ADSAS application within the past 3 years. Pre-Dental Mentor offers essay reviews, mock interviews, resume editing, secondary application editing, DAT prep, a personalized schools list, and an application checklist. To pre-order, slide into our DMs and get 30% off before June 1st. Contact us at dental.student.vibes on Instagram or email us at dentalstudentvibes@gmail.com. We only have 25 spots, so sign up before it's too late. We sincerely thank you for your support over the past year and are extremely happy to have the opportunity to give back. We were just in your shoes not too long ago.